But there is some good news. Doctors are working to save lives, and they now have more effective tools and treatments than they did just a year ago. However, they say more Mainers need to do their part to protect their communities. Newscenter Maine's Vivian Lee has more.
It's a distinction that no hospital in Maine wants.
These are records we don't want to be setting.
Dr. James Jarvis is a senior vice president at Eastern Maine Medical Center in Bangor. This week, EMMC saw its highest number of COVID-19 patients since the height of last winter's surge. The Delta variant is the game changer, with patients up to 2.5 times more likely to be hospitalized.
We hit 55 patients at Eastern Maine Medical Center last January, and that was the state high. And now, obviously, we are above that now.
The hospital's parent company, Northern Light Health, also set a record with more than 80 COVID-19 patients across its 10 member hospitals. But the demographic of this wave is a stark contrast to the early days of the pandemic. Instead of being in their 60s and 70s, these patients are under 50, and the vast majority are unvaccinated.
These individuals are sicker than we saw before.
But hospital systems have more tools to keep people off ventilators. There are steroids to treat seriously ill cases. An FDA-approved antiviral treatment called remdesivir has been effective for patients who are not on life support. Patients who are high risk but have milder symptoms can receive monoclonal antibodies through an IV. But making the treatment widely available is a growing challenge.
Unfortunately, due to the high demand, supplies are limited, but we are working rapidly to try to improve access for monoclonal antibodies.
As of Thursday, Maine Medical Center in Portland had 32 hospitalized COVID-19 patients, well below a high of 45 in January. Dr. Dora Mills is the Chief Health Improvement Officer for Maine Health. She says MMC is the only hospital in the state with ECMO beds for patients who have deteriorated despite being on a ventilator.
ECMO stands for extracorporeal membrane oxygenation. So it's basically giving your lungs a rest and oxygenating your blood.
As we head into fall and the flu season, medical experts say the best line of defense against COVID-19 remains getting vaccinated, wearing a mask, and practicing good hygiene. The hope is these precautions will turn the tide of growing cases soon. Vivian Lee, News Center, Maine.